We will get started here. One thing just to let you know is that we are recording this. It will be available later in maybe a week or 10 days. And at that time, if you look on our YouTube channel, you will be able to find this along with a copy of the slides here. So there will be a way for you to access listening to parts of this again, as well as to download the slides if that's helpful to you. So we will cover in different steps here how this process works. So first, we'll talk about what TRIP and TRAIL are. You may already know that, who's eligible, how you enroll, who the different parties are that are involved in TRIP and TRAIL. And then we'll look at what premiums are. There is something new that we refer to as the Medicare Family Split. I will explain how that works. And this, particularly since it just started in July of this year, might be new information for those of you on this call. And then we'll talk about how do you transition from TRIP to TRAIL. So let's get started. TRIP is the Teachers Retirement Insurance Program, and this is your health insurance, prescription drug, vision, and dental. Vision and dental were included beginning July 1st of this year. And this is your primary coverage before you turn Medicare age. Most of the time, you will go on Medicare on the first of the month that you turn 65. So this is the primary coverage before you become Medicare eligible. There are a variety of programs and insurance carriers. You may be familiar with this if you are already on TRIP with TRS. There are different times that you could enroll, but the annual open enrollment period is generally the month of May, and then it's effective July 1st, a July 1st start date. As I just mentioned, it is your medical. It includes prescription drug, dental, and vision. And this is available to you and to your dependents. TRAIL is the program that we have available for you when you go on Medicare. Again, most of the time that's at the age of 65. So this is the Total Retiree Advantage Illinois. That's what TRAIL stands for. And it is a Medicare Advantage program. In order to go on TRAIL, you need to enroll in Medicare Parts A and B. That is basic Medicare. Medicare Part A is hospitalization. Part B is what they refer to as medical, and you need to enroll in both parts A and B. The open enrollment period for TRAIL is different than it is for TRIP because it aligns with Medicare. So this is going to be mid-October to mid-November, and then it's a January 1st start date. The TRAIL coverage, we have one program available. It is available nationwide. It's the Medicare Advantage program, and it's a PPO through Aetna. And it also, just like TRIP, includes prescription drug, dental, and vision, and is available to your dependents. In order to be able to enroll in either TRIP or TRAIL, you need to have at least 8 years of service credit with TRS. Most of the time, our retirees do have this, but if a lot of your service credit ended up being from a reciprocal system, there is a different criteria for enrolling TRIP and TRAIL in that 8 of your years must specifically be with TRS in order to be eligible. You don't need to enroll if you have other insurance available to you. You can do that, and then you can enroll in either TRIP or TRAIL at a later time. The earliest that you can enroll on either of these programs is the first of the month following your retirement. You can also come on when you lose other coverage. So if you had other coverage available at retirement and didn't need either TRIP or TRAIL, but then that other coverage ends, then you can use a termination letter from that and start TRIP or TRAIL at that time. Then you can enroll in TRAIL once you become eligible for Medicare, typically at the age of 65, or during those open enrollment periods that I just discussed. So the month of May, effective July 1st for TRIP, and mid-October to mid-November, effective January 1st for trail. Part of the reason that sometimes getting onto trail and Medicare and such can feel confusing is because there are different parties involved. So TRS has a couple of roles in this process. First, we're going to determine if you're eligible. Are you retired? And do you have at least 8 years of service credit with TRS? And then we are going to withhold the monthly premiums from your pension. That is what TRS will do. Now, the state of Illinois, Central Management Services, or CMS, is the plan administrator. And what that means is they are the ones that choose and negotiate what companies and pricing are available. So that is not a role that TRS plays in all of this. CMS is the one that negotiates the plans and the pricing. And then there's a third party involved, which is called My Benefits Service Center. And they are the organization that will actually handle the enrollment. So we'll talk about how these pieces all work together. This premium chart here is for people that are not yet on Medicare. You may be familiar with this if you were on TRIP already. So you are the benefit recipient as a TRS member. Your spouse and or dependent children would be in the dependent category down here. Everything on this chart is per person per month. So the HMO or open access for you, $370 a month. For a spouse, $1,483 a month. And then your dependent children are over here, $484 a month. The PPO, $857 for you, $1,726 a month for a spouse, $624 a month for each dependent child. You may be familiar with this if you are already on the TRIP program. I will say just a quick word about this last column here. Very, very likely, no one that is on this webinar would fall into this category. A long time ago, before 1985, TRS members did not pay into Medicare. There were different times when you may have participated if you switched employers after that time or were Medicare eligible through a spouse, something like that. But at this point in time, there are very, very few people that are receiving TRS benefits that are not eligible for Medicare because they never paid in. If that happens to be you, then you would stay on the TRIP program because the only way to go on trail is to enroll in Medicare Parts A and B. But very, very likely, no one that has joined us today would fall into that category. Once you are Medicare eligible, then the one program that we have is the TRS Medicare Advantage program through Aetna called Trail. You are the benefit recipient, and your premium for the Medicare Advantage program is $7.35 a month, and a dependent would be $27.14 a month. This premium would be in addition to whatever cost there is for you specifically for Medicare Part B, and we will come back to that in a minute. Now, the new thing that I mentioned that could be something different than what we told you when you retired, if it's been a while, is something that just started July 1st of 2025. In the past, if you were the member and you turned 65 and went on Medicare, you went right on trail. But if you had a dependent that was not Medicare eligible, then the Medicare eligible person was paying one premium on the TRIP slide, and then the person that was not yet Medicare eligible stayed in TRIP. at the $370 a month or whatever that rate was. So previously, everybody had to stay on TRIP until anyone that was covered on the insurance was eligible for Medicare. As of July 1st of this year, that has changed. The change is this: when someone becomes Medicare eligible, they will go on trail at that time. And the other person or people, if you have dependent children or something, will stay on TRIP. So now it is possible to have some people on TRIP and others on trail. You don't have to wait until everyone is Medicare eligible. If you do want to go on trail, you are required to enroll in trail at the time that you become eligible. So putting all of these pieces together, this is what this looks like. For you, if you are the only person on the program, when you become eligible for Medicare, you will go from these TRIP, not Medicare primary rates, over here to trail in the last column. If that is you becoming Medicare eligible and you are married to someone that is not yet Medicare eligible, they will stay over here in the not Medicare primary column. So $14.83 a month if they're on an HMO or open access, or $17.26 a month if you are on a PPO. And the Medicare eligible person is going to come over here and pay $7.35 a month. Or the reverse could be true. If you are not yet Medicare eligible, you're going to stay over here in the not Medicare primary, and a spouse would come over here to the $27.14 a month. So now you can have one person in the not Medicare primary and someone else in trail. That is new this year. So how do you transition to Medicare? Well, Medicare is actually part of the Social Security Administration, not part of TRS. So about 3 months before you or your dependent turns 65, you're going to get a letter in the mail, and it will contain the trail information, a Medicare checklist, and we're going to cover the pieces of that checklist here, and you will get that in the mail. Here's what it will tell you to do. You need to contact the Social Security Administration. Medicare is a part of Social Security, and apply for Medicare Parts A and B. You can either do that online using the website that is shown here, or you can call them. Medicare Part B is going to have a cost. Medicare Part A is almost always free, hospitalization. Medicare Part B does have a cost. Everybody pays for Medicare Part B, but TRS does not know how much that will be. And the reason is that Medicare Part B is dependent on your household income. And that cost structure is set up by Medicare, not by us. So in order to find out what your Medicare Part B cost is going to be, you would need to look on the Social Security website and look this up. We are not able to tell you what that will be. So that's going to be determined by Social Security. Then also, when you go out there to apply for this, there's a couple things that you're going to need to verify. You need to verify your name and your residential and mailing address as they show up on Social Security. It needs to be a current address. And it also needs to be a current name for somebody that may have changed their name over time and given a name change to TRS. You also need to be sure that that name change has been transferred over to Social Security and Medicare as well. You need to verify that the name and address are the same as what is on your TRS record. And that way, when you apply for Medicare, and then they transfer the information and let us know that your Medicare is being paid for and such, we need to be sure that the list with the name and address is exactly the same as what TRS has. So you will need to initiate any name and address changes. And actually, this would go into the future as well. So if you move, you would need to change your address with both Social Security and TRS. Then once you've applied for Medicare A and B, you're going to get your Medicare card in the mail. Now, if you happen to fall into that very unusual category where you never paid into Medicare, then you would get a letter from Medicare saying that you're not eligible, and you would send a copy of that to us. But again, very likely no one on this call is in that situation. So when you get when you get your Medicare card, you're going to make a copy of it and upload it to your TRS account. That is a secure way to transfer that information to us. You can also mail it to us, but we just need a copy showing Medicare A and B and the effective date of that. If you are not currently on TRIP, but you want to participate in the TRAIL program, then you will need to call TRS and get a participation election form. That will allow us to send you through the various systems. So TRS will set you up. We will let CMS know that you're enrolling, and they will let My Benefits Service Center know you're enrolling. So in order to get all of that started, if you have not been on TRIP, but you do want to participate in TRAIL, then call us. We'll get you that form and get that process started. And then when you send in that TRIP participation election form, you could include a copy of your Medicare A and B card along with that. And then we'll have everything that we need. During the month the month before Medicare goes into effect, you're going to want to just take a look at that TRAIL Medicare Advantage enrollment guide. You will get a copy of that from the state of Illinois when you get that Medicare letter, or you can find it on mybenefits.illinois.gov. So you can look through that information. That is the only program that we offer. So you'll want to make sure that that fits your needs. Then what you would do is contact My Benefits Service Center at the phone number shown here, 844-251-1777, and give them a call by about the 25th of the month prior to when you need Medicare to be effective, and tell them, yes, I do want to go on the TRAIL Medicare Advantage program. Medicare is almost always going to be effective on the first of the month that you turn 65. The exception to that could be if your birthday is on the first of the month, then Medicare will take effect the first of the prior month. And other than that, it's very likely going to be the first of the month that you turn 65. So what happens to those that are on TRIP and they want to go on TRAIL? Your TRIP coverage is going to automatically cancel on the last day of the month prior to when Medicare takes effect. And this would happen if you are on the coverage by yourself on TRIP, then TRIP will cancel on the last day of the month. And then if you do elect to go on TRAIL, then that will become, you will call My Benefits Service Center, and that will become effective the very next day. So there's no gap in coverage. TRIP cancels on the last day of the month, and TRAIL takes effect on the first of the next month. If you have multiple people on your TRIP program, then just the person who is going on Medicare will cancel on the last day of the month, and their TRAIL will take effect on the first of the next month. The person that may not yet be eligible for Medicare will stay on TRIP. Their coverage does not cancel. And then if you are not eligible for Medicare, again, that very rare instance where you never paid into Medicare, then you can stay on TRIP at that much higher premium that was in that column. So this was so many things to do. So we'll review what you need to do. You need to initiate your Medicare coverage with the Social Security Administration. We will send you a letter 90 days ahead, but you do have to contact Social Security Administration either online or give them a call and get your Medicare A and B in place. You also need to verify the name and address that is on your profile with Social Security Administration and be sure that that matches what is on TRS. Throughout the time that you are in Medicare, you need to continue to pay the appropriate premiums to the Social Security Administration. If you are a person that is collecting Social Security in addition to TRS, they will automatically take that Medicare Part B premium out of your Social Security. But otherwise, you have to make payment arrangements with Social Security. I believe they either do monthly deductions or maybe you pay them quarterly or something. So you will need to arrange with them to pay Medicare Part B and to keep it in force. And then if you plan to use the TRAIL program, you need to send the appropriate forms to TRS, and you need to call My Benefits Service Center to officially elect your enrollment into TRAIL. Even though there is only one program available, you do need to officially call and say, I do want to be on the TRAIL program. If you decide you do not want to be on TRAIL and you want to get a completely different program in the retail market, you want a different Medicare supplement or something, that is fine. Then you don't need to call My Benefits Service Center and your enrollment will be waived. But if you do want TRAIL, you need to call them, preferably by about the 25th of the month prior to when Medicare will take effect so that everything is in place. Just a note about the premium changes. For those of you on TRIP, you're probably familiar with this already. Your pension is paid on the first business day of the month for the month prior, and your TRIP premiums or TRAIL premiums are deducted the same way. So, for example, if you are going from TRIP to TRAIL effective November 1st, the pension payment that you get on November 1st is actually for October, and your TRIP premium was still in effect then. So when you get your money on November 1st, it will still have a TRIP premium coming out. Then when you get to December 1st, that will be for the month of November, and that will include your November pension payment as well as the TRAIL premium will be reflected using the example that I have here. Okay, lots of information there. Nick and Carly, do we have any questions?
Well, not yet. We don't have any questions, but this is the time for you to enter your questions into the Q&A box. So if you are looking at your dashboard there, where you can raise your hand, there's also a Q&A box. It looks like a square speech bubble with a question mark in it. If you click on that button, that gives you the opportunity to enter your questions as a text question. Some of those that are good for the group that everybody may want to hear the answer to, I will address to Sandy so that she can give an answer for the good of the group. Others, Carly will answer individually. So if you have those questions, go ahead and put those into the box. In the meantime, Sandy, super job. This is a lot of information, but it is important information. Health insurance is an essential element to life and retirement. So this really is an important topic. We do have some questions coming in. Specifically, I have the Aetna PPO in TRIP. Is that the same as the Aetna PPO in Medicare Advantage?
It's a great question, and it is not the same because a Medicare Advantage program is completely different than Medicare is actually underlying with a Medicare Advantage program. So what would happen with a Medicare Advantage is that you will have Medicare A and B, and you'll have your Medicare card. You can keep that at home. And then you would have your Aetna card that shows the Medicare Advantage. When you go to a provider, being a doctor, hospital, anything like that, you give them the Aetna card. Aetna covers the cost of whatever is eligible for Medicare and the additional part, and they deal with Medicare sort of behind the scenes. So it is a different program than than the Aetna PPO.
Excellent. Thank you very much. Next question is, what happens if I move out of state while on trail?
Since it is a PPO, really the PPO is countrywide, and any provider that accepts Medicare should accept this Medicare Advantage.
Thank you. Can a person add a dependent to trail when they enroll if that person is already on Medicare but has not previously been on TRIP with them?
If they're not on, if they are just becoming Medicare eligible, that would be an event, and they could be added to, we'll say the member is on TRIP and the spouse has had insurance elsewhere and is now Medicare eligible. If they are coming onto trail at their time of Medicare eligibility, then that event would allow them to join trail. If they have been on Medicare for a while and sometime along the line decided they wanted to come onto trail, then they need to come on during open enrollment. But yes, a spouse that was not previously on TRIP can come on trail.
Excellent. Thank you. Our friend Kathy has a question. She is already on TRIP and she is using the new dental and vision offering. When she goes on to trail, will she keep those same dental and vision cards or will she get new cards?
I believe they will send new cards. It is really viewed as a completely new program, even though the coverages are similar on both of them. One thing to note when you go on there, you are switching programs on the first of the month that you go on to Medicare. So your deductible and out of pocket is going to reset that one time. And then trail is a calendar year. TRIP is the July 1st through June 30th, but trail is a calendar year. So you may see a reset on there depending on when your birthday is.
Thank you very much. Sandy, next question is about notifying Medicare. Does a person need to notify Medicare that they have enrolled in trail?
They do not need to specifically notify Medicare, no.
Thank you. I was told that once I had an Advantage plan that I could never enroll in a supplement. Can you speak to that?
Actually, I cannot categorically answer that. I don't know. I think you would have to check. I don't know if that's an all or nothing. It probably depends on what Medicare supplement you want to join, but I think you would need to ask that question of the Medicare supplement that you wanted to participate in.
What we do know, though, is that you cannot have an additional supplement while you're on trail, though, correct?
That is correct.
Okay. I didn't necessarily interpret the question to mean that, but it is worth knowing.
And also, you would not, when you do the Medicare Advantage program, it does include prescription drug. You do not enroll in Medicare Part D, which is if you are getting a Medicare supplement in the retail market, may or may not need Part D, depending on what you buy there. But with the trail program, you do not enroll in Part D.
Thank you. Lynn wants to know what happens if I am going through this process of transitioning into trail, but I don't yet have my Medicare card on the day that I turn 65 or the day that my Medicare would take effect.
We do need the card. Then what would happen is as soon as you get the card, you get it to us. That's why we suggest beginning to work on this about 90 days ahead. Medicare cannot be backdated. So if you have not gotten notification that Medicare is in place, what will happen is your trail enrollment will happen the first of the following month. You would still have Medicare A and B in place. We cannot get you on the trail program until the first of the following month. So it really would be most helpful to you to not have to worry about this, to begin pursuing that Medicare A and B card in the 60 to 90 days prior to when you're going on Medicare, just to give yourself plenty of time to get this done.
Terrific. Thank you. If I were to choose an outside supplement instead of Trail, would I be able to still join Trail later on?
You could. You could come on during the open enrollment period if you went somewhere else first.
Do I need a termination letter from TRIP in order to transition to Trail?
You do not. We will automatically terminate TRIP when you become Medicare eligible. You cannot stay on TRIP for an extra month or two. Once you become Medicare eligible, we will, you or a dependent, we will terminate coverage when you're no longer available. And then automatically, if you go on Medicare and send us the card and such, it would be effective the next day. So there won't be a gap, but you do not need to do anything about canceling.
Thank you. The costs for Medicare B, not the TRIP or Trail premium, but that cost for Medicare Part B, is that something that is deducted from my TRS pension check?
It is not. That's a great question, just so that I could reiterate that it's very important that you arrange with Social Security how that is going to be paid. The Medicare is a federal program. So we have our Trail program to, if you will, overlay that and be a Medicare Advantage. But the parts that have to do with Social Security and Medicare, those have to be taken care of through them. So either if you collect Social Security yourself, they'll take that Part B premium out of your Social Security automatically. Otherwise, they will give you options of how you are going to pay it. And that will be to them, not to TRS.
Thank you. Here's a scenario. We've got a member whose spouse is insured independently. He's still working and insured independently, but is already age 65. When he leaves that position, when he retires essentially and loses that coverage, what is the process for adding her dependent spouse to her Trail coverage if she's already on Trail?
So if you are on Trail, that is going to be the event that would allow a spouse to join at that time would be termination of coverage from where they're working. They would go ahead and get started on Medicare A and B ahead of time, so they're ready to go. And then we would get the Medicare A and B card for the spouse, and they would you would contact My Benefits Service Center to actually add a spouse. They will be looking also, anytime you're adding a spouse or a dependent, you do need a marriage certificate, which allows a dependent to be on your insurance. If it's a dependent child, that has to be a birth certificate. So we would need something to add them, but they would contact My Benefits Service Center to be added to your Trail program. And that would end up requiring a termination letter if they're not just turning 65 at that time.
Thank you very much. I've marked a number of questions still for the good of the group. Carly is answering some individual questions individually. So make sure you're checking that answered questions box or that answered questions tab if you have posed a question that was a little more specific. I have one here regarding a person who is turning 65 in the month of December has already applied for and received their Medicare card. Would that person call now to start the transition to Trail, or should they wait until closer to December 1?
You can go ahead and send us a copy of that card so that we can get that set up. And then, you can call My Benefits and tell them that you're going to be effective. It sounds like it would be December 1st. So that's fine. And then it's just done.
Thank you. Mary would like to know, is there a way that she can see which doctors or physician groups are a part of the Trail Medicare Advantage network before she enrolls?
You could go on to, certainly if you look on the information that you get regarding Trail, there you can always go in there and look and see what doctors are covered. For the Trail program, because it is associated with Medicare, any provider that accepts Medicare should be willing to participate in this Trail program as well.
Thanks.
And it is a PPO, so.
Thank you. James would like to know how he can learn more about the specific coverage under the Aetna PPO Medicare Advantage plan. One, for comparison, or two, just to make sure that it's going to be adequate for him.
That again is in the materials that you would get. So it'll show what the annual deductible is, the out-of-pocket, and the various, there's a chart there that will show you the different things that Trail covers. If you are looking to compare it to something in the retail market, that is not something we can help you with because we can't go through what another company may or may not cover. But you may be able to get the same type of chart from a different company, and then you could put those together. But that information, there is a chart that would be included in the Trail materials, so you can look over that.
Thank you very much. Sorry, a number of questions here. I'm just kind of screening. Wanda would like to know if she has already paid for her Delta Dental deductible for the year. Would that reset when she transitions over to Delta Dental under Trail? Do you know?
I am not positive. I believe it will reset. It is a new program.
Yeah, I do not know the answer to that question either. Wanda, I would give a call in to TRS, and we can direct that either to a supervisor in the insurance department or otherwise get that information for you. So good question. Okay, moving forward. Can you just confirm when it is that Trail open enrollment occurs?
The dates vary a little bit depending on day of the week, but basically October 15th to November 15th, mid-October to mid-November, effective January 1st.
Thank you. I will
mention one other thing about the open enrollment is that Central Management System, CMS, does hold meetings throughout the state, and they are often very well attended. And then they have virtual meetings as well. And they will hold those meetings so people can learn about transitioning and what the Trail program is. Often they will have people from the carrier there, from Aetna. One thing that also is something TRS cannot help you with, but maybe a very important question for you, is what types of prescription drug, different prescriptions that you take, are they viewed as regular or specialty? Those, we don't know how those formularies are going to work with a carrier. So that is something that you can check. And sometimes people will attend those meetings and be able to check on some of those things. Or that would be something that you would check with Aetna on if that's important in your decision, if you have very specific drugs that you need to have covered.
Thank you. We have an individual who is asking about, they have Delta Dental coverage independently when they enroll in Trail and therefore have Delta Dental through Trail as well. Can they use both policies? Can they coordinate both policies?
That would be a question for them, I guess. It often coordination of benefits ends up being more complicated than helpful for you. I don't know which would be considered primary. For the most part, it is helpful to have one level of insurance in place rather than trying to have another supplementary. But that would be something you would have to check with your private Delta Dental to see whether or not they are going to coordinate benefits with the Trail program.
Judith she's just looking for a little clarity about something that you'd said in answer to a previous question about prescription drug coverage and that you do not need a Medicare D coverage. Can you just confirm what that, how it is that their prescriptions are covered through the Medicare?
They are
Trail
on a Medicare Advantage program. It is covered with medical, prescription drug, vision, and dental. It is all one program. So to discover, you could check on particular drugs you have, but it is not a separate Medicare part that you need in order to get that coverage. It is already part of the trail program. Happy birthday to all of you that are coming up on 65. Usually, in many cases, it's a reduction in health insurance costs at least. So of all of the birthdays that you have, this could be a very welcome one. I hope this works well for you. So thank you for joining.